Good afternoon. My name is Linnea Winquist. I'm Director of Spiritual Care over at Marianjoy Rehabilitation Hospital, and it's a real pleasure to be with you this afternoon. Thank you for joining us today on this presentation about a form of acupressure that's called finger holds. I'm joined in the room with Susan and Angela here, and I'm just really grateful to them for their invitation to be a part of the presentation today. Living Well, as most of you probably know, is part of Northwestern Medicine and offers 100+ free programs and services for cancer patients and their families. And we are filming from the building here at Living Well this afternoon. If you have any questions during my talk, please don't hesitate to post them in the comments section, and then at the end of the presentation, we'll work through as many questions as we can. I'd like to start off by just talking with you a little bit about my own journey in learning about acupressure and specifically about finger holds, which is going to be the focus of the presentation today. When I started working in chaplaincy at Marianjoy, I realized right away that Marianjoy is kind of like a little paradise in the chaplaincy world, because the philosophy of Marianjoy is really geared toward care for the body, mind, and spirit. So our chaplaincy program is really integrated into the whole philosophy of care at the hospital. When I started working there, I was introduced to this practice, and the practice of finger holds and using finger holds to support well-being and healing has been a part of our practice at Marianjoy for many, many years, dating back to our association with the Wheaton Franciscan Sisters. When I learned about them, it was already a little bit familiar to me because I had had some training and am licensed in the practice of Reiki. And Reiki and finger holds have some overlaps and common ground in terms of an understanding of meridians and the flow of energy through the body. So to start off, I just want to give a disclaimer that we're not going to be talking about like acupressure, kind of full body acupressure today. First of all, that's not within my scope as a chaplain. Secondly, it's just too much for a presentation in this amount of time. But just kind of keep it at a really high level and teach you how to use a really simple form of acupressure. Again, related to just supporting your well-being and healing. So the difference between acupressure and acupuncture has to do with needles or no needles. So acupuncture actually involves the use of needles to hit those specific points in the body and promote a good flow of energy and chi. Acupressure deals with some of those same points, but instead of using needles, it's just using, of course, obviously, pressure. So it's just, using the fingers, or in some cases, another kind of instrument. Sometimes people use the elbow to get to some of the points when using acupressure. But in acupressure, there's no needles. There's also a difference between acupressure and reflexology. You might have heard of reflexology. Acupressure, if you're going to do a whole acupressure treatment, involves points along the whole body, whereas reflexology typically focuses on the feet, although reflexology can have connections to the hands as well. The origin points of acupuncture and reflexology are different as well. For acupressure and acupuncture, the origins are in Asia. It again is a treatment to help promote a healthy flow of life force through the body. And a lot of the philosophy and theory behind acupressure is around imbalances of energy in the body. Acupressure and acupuncture deal with 4 long, thin energy lines that are called meridians that run through the length of the body. And there's more than 800 different points along these lines. Fewer than 30 are found on the feet and hands, but they run through the whole entire body. So a full acupuncture treatment would deal with a lot of those points along the bodies, accessing them with needles. I'm going to pause here and just say, if you want to go deeper into learning more about acupuncture or have a treatment of your own, the Asher Integrative Medicine program downtown through Northwestern has several practitioners listed on their website. And I checked it out today, actually, before the presentation, to make sure that I could find it easily. And you can kind of just follow the links in that website to the practitioner area, and there's 3 people listed there. So that would be a really great Northwestern resource available to you if you wanted to go deeper into an acupressure treatment. There's also practitioners listed on there for healing touch and Reiki, which I mentioned earlier. Reflexology, the roots of reflexology are actually traced back to Egypt. So whereas acupuncture, acupressure, more roots from Asia, the reflexology date back to ancient Egypt. And the theory is that there's reflex points along the feet that correspond to different organs in the body. So modern reflexology practitioners apply the findings to manipulation of the feet and to a lesser degree the hands and ears to promote good health. Lots and lots of research has been done on acupuncture and acupressure pointing to positive benefits, one of which is promotion of relaxation. At Marianjoy, a lot of our patients struggle with pain, and pain can be a real barrier to progressing through therapy and getting the kind of movement that's needed to keep them healthy and progressing in the context of whatever challenge it is that they're facing. A while back, we at Marianjoy stepped back and actually realized that a lot of the practices that we use in the spiritual care chaplaincy world also have efficacy to promote comfort and help with pain relief. So we put together a little educational program to teach some really basic strategies around pain relief and comfort. And I think Sue and Angela are going to attach those to the Facebook page so you can actually see the curriculum. There's 7 easy to use, easy to learn, and inexpensive practices. And it was really important to us that we had those kind of guidelines to make our selections, because there's lots and lots of things that we know can be really helpful, but we wanted to pick things that people could use in their family rooms, right? Things that that could be easy to access and wouldn't have a lot of barriers to being able to enjoy and use them as frequently as you'd like. So the 7 practices are there, and when Sue and Angela and I were initially talking, I had thought about kind of going through all 7 of those practices, but in a time span of 30 minutes, that's not too practical, so we chose to kind of focus on this finger hold practice as something that might be more manageable in the time frame, and again, something really practical that you could use. So the history of finger holds is actually really ancient, but was rediscovered in about the 20th century by a practitioner who kind of reconnected with the ancient tradition. Again, it's rooted in some of the same discoveries as acupuncture and acupressure, but the finger hold practice is specific to the hand. And in the ancient teachings, each of the fingers on the hand are associated with different emotions. And there's a handout that we use at Marianjoy that will also be attached to the presentation that kind of gives a diagram of the hand and the corresponding emotions that are historically understood to be connected to each finger. So the grief and tears is often associated with that thumb. So that when we teach this to children, we teach that sadness or sad emotions are connected to the thumb. For the pointer finger, that's the fear and panic emotion. And if you think about your pointer finger, if you get really, really mad, you sometimes use that pointer finger, and it can be a real accusatory kind of finger. And that emotion is oftentimes related to fear. The middle finger, not surprisingly, if you were going to take a guess, the middle finger is the mad finger, or the anger finger. And when people get really mad in our culture, that's sometimes the finger of choice to express the really intense emotion of anger. The next one, the ring finger, is associated with love, and there's actually blood flow that goes straight from that finger directly to the heart on the left hand, which is an interesting physiological connection. But that finger is also connected to worry or anxiety. And the last finger, easy way to remember it is I feel small. It's a finger connected to self-esteem and self-worth. So the finger hold practice basically involves a gentle engagement with each of the fingers. And the traditional practice is to just take your one hand and gently hold on to each finger one at a time. You can start with whatever finger you want. If you're engaging in the practice in a shorter kind of environment, you can just pick one finger based on kind of the support that you feel like you need in that moment. But you take your one hand and just kind of hug that finger and gently draw your attention to your breathing as you're gently holding onto your finger. And what typically happens is that you might start to be able to feel your pulse in the hand that you're using to hold the finger. The recommended time for adults to practice a finger hold is 2 to 5 minutes on each finger. Over time, as you gently breathe comfortably in and out, you can typically start to feel the pulse in the finger that you're holding. So when you feel that pulse in the finger that you're holding, that's thought to be the point of connection with that energy, life force that we were talking about earlier. When that kind of sensation is felt, you want to continue to just hold that finger with loving kindness. What some practitioners recommend at this point, and this is actually a practice that I use, when I start to feel that pulse, I just start to gently massage the finger from the wrist side out. And what this practice does is to release that energy. So what we're trying to do is to promote just a really healthy flow of energy through the body and release any kind of emotions that might be getting in the way of our healing, of our well-being, of our peace, of just that good flow of energy through the body. And after you've been able to do that and just release those from the body, then you start with the next finger. And you just repeat the same thing, being attentive to the emotion, perhaps, that's associated with that finger. So right now I would be mindful of fear. Is there anything I'm afraid of, or that really is a deep root of fear in my spirit right now? Again, pay attention, do some nice mindful breathing. And when you start to feel the pulse in that finger, gently do a massage and try to release that fear from your body, right? We're letting go. We're letting go of fear and leaning into peace or joy or gratitude, whatever it is that we need. Same thing with the next finger, anger. What kind of anger am I holding in my body? What kind of anger might be getting in the way of me being able to kind of enjoy whatever it is in my life that is a gift right now, right? There may be a lot of things that don't feel like gifts and that aren't considered gifts. And there may be some things like a loving relationship or the soft fur of a pet or something beautiful, the bloom of a rose, right? So we're releasing any anger that might be getting in the way. Same thing with worry. Same thing with insignificance, right? So the practice is 2 to 5 minutes on each finger, and then we would switch hands and be able to provide that same kind of nurture and support to the other hand. So what's interesting about this practice, I've taught it to a lot of people through the years. And one time I remember specifically, there was a person in a class where we were talking about the use of finger holds, who when I talked about the thumb and the thumb being associated with grief, she spontaneously burst into tears. And I just gently, offered her some support and asked her if she would be interested in processing the tears that went along with the education around the thumb being associated with grief. And she shared with the group at the time that for the last several months, she had just spontaneously started holding her thumb in her hand like this. And that just for reasons that she could not understand, she just kept doing it because she found it to be comforting. It was something that she knew when she held her thumb like that, it just helped her to feel better. And I said, wow, was there anything that happened 2 or 3 months ago when you started to do that practice? And she said, yeah, 2 people that I really loved died around that time. And no one ever taught her about the practice. She just discovered it on her own, like some wisdom inside of herself drew her to the practice, and she just started grabbing onto her thumb. And when she learned about the history of that thumb being associated with grief and tears, it just meant the world to her because it just was such a validation that she had learned a practice that was rooted in all of this history and rich wisdom that others had discovered as well. And it was just a really meaningful time with the group to kind of celebrate her awareness of that and her practice. Another time I had shared this group with a bunch of my colleagues who are professionals in other disciplines at Marianjoy. And one of those colleagues was with me in a meeting, and the meeting was kind of getting a little tense. There was, some heated discussion around a different topic. And one of the pharmacists was sitting by me, and she had been at the presentation. And it wasn't even a conscious thing. I was just starting to massage my fingers in the midst of the meeting. And she was sitting right next to me, and she goes like this with her elbow to me, and she shows me her hands. She was doing the same thing under the table. We were both practicing the finger holds in the context of the meeting, just to help us to support our equilibrium in the midst of the conversation. It was a nice little bonding moment for the two of us, but it was fun for me too to see someone trained in a totally different discipline, in her case, pharmacy, who we typically associate with, leaning into medication so heavily. She found the practice to be really beneficial to support her well-being and peace of mind in the midst of the meeting as well. So everything that we just talked about is also on this handout that I hope is attached to the presentation. And I think I'll just pause right now and see if there's any questions that have come in so far related to what we've talked about.
So there's a viewer who wrote in saying that her husband has peripheral neuropathy in his right foot due to chemo and immunotherapy. With this, some sore spots developed that turned into ulcers, and they've undergone angioplasty to help improve the blood flow. But the question is there anything that acupressure could do to help him with these ulcerations and spots?
So great question around the use of some of the acupressure or potentially even acupuncture to help with peripheral neuropathy. I want to reference kind of back to what I was mentioning right at the beginning, that we're today kind of reviewing a really basic form of acupressure. One of the things I would encourage is to just invite your husband to try some of the finger holds. I can't kind of speak definitively to the connection between finger holds and peripheral neuropathy, but the finger holds can help with relaxation and comfort. But specific to peripheral neuropathy, I might point you back to that website relative to the integrative medicine clinic downtown, because some of those specialists in acupuncture would be in a much better place to specifically address how acupuncture or acupressure might help with a specific diagnosis like peripheral neuropathy. But thank you so much for the question. And I love that, there's openness to exploring some of these other venues to possibly support in the midst of that. So thank you.
Do the acupressure machines for feet work well for neuropathy following chemo?
That would be another great question for those same folks that I referenced before. A great question that would be, I think, a really good one to ask them.
Would you say, or would you know, is acupressure more effective than acupuncture?
So that would be another really good question to ask for them downtown. I think I can say, what I can say about that question is this. One of the benefits of the finger hold technique is that you don't have to make an appointment for it. It doesn't involve any kind of equipment. Acupressure or acupuncture, obviously, you would need to go to a clinic to have someone who has all the needles available and can provide that acupuncture treatment, whereas acupressure is a little bit more easily accessible. If you were wanting to do some acupressure yourself or learn if there was a way to incorporate more of a full body experience, my encouragement would be to visit with an acupressure, someone who's certified in acupuncture, and see if they could recommend an acupressure kind of follow-up that you could do on your own. They may have something that they could recommend to you for that. But that would be my recommendation, to talk with someone, again, maybe a person on that list I referenced.
How frequently can you do acupressure treatments for yourself?
So for the finger holds, again, what we recommend is that 2 to 5 minutes per finger. And you can repeat that at intervals throughout the day. If you wanted to do it 2 or 3 times a day, that would be fine. But as far as the finger holds, those are the time frames that we recommend. People who have been practicing this a lot, and on the website, if you're interested, there's a lot of different places that have specific information. There's one website that's particularly helpful that is like the Center for trauma that recommends the use of this, and I can give the specific website to Susan and Angela that you can post on the website as well. But they go a little bit deeper into the use of finger holds specifically for recovery from a variety of different experiences that we have. So yeah, I would say 2 to 5 minutes on each finger. What they say is that for children, and this is how I got to that website, for children it's actually faster. They can typically feel their pulse faster than adults can using the finger hold. So it might be up to 2 minutes for children, 2 to 5 minutes for adults.
I think last question, are there any side effects of acupressure?
The type of finger holds that we use, obviously you want to be careful not to squeeze your fingers too hard, right? Just a gentle hold on your finger. But the finger hold practice that we use is very safe. So you can use it, and again, just make sure that you're using it in a comfortable way. You're not overly, squeezing onto your fingers. You don't want to make them, painful or cause, a lot of blood to be trapped at the top of your finger, that kind of thing. But just gentle holds on the fingers is very safe practice. Great. All right. I hope you enjoyed the presentation, and blessings for your gentle healing.